Let's evaluate you later. So this is okay. Dear Dr. Jeremy, that is fine. 4 years old. I'm writing urgent to refer Mr. John Alvin. I would write Mr. Alvin who has signs and symptoms suggestive of anterior myocardial infarction. M should be small, or acute exacerbation of asthma with pulmonary edema. Your further assessment and management would be appreciated. Okay. Today, Mr. Alvin presented with sudden onset of crushing on chest pain, which is preceded by uncontrolled asthma. On examination, he has. If you have to write he has here, then there should be has over here as well. He has moderate wheeze with mild bilateral crackles and slight S3 sound detected on chest auscultation. The ECG revealed mild ST elevation in the anterior leads, so plan to transfer him emergency department with paramedics. There is no need to write that he was transferred and this and that. Anterior lead, that's it. You can end your sentence with it. You don't need to overly explain things. Okay. His 150 liter oxygen via non-rebreather with GTN patch, and he was given IV morphine. Now again you are writing was before you're writing is, so how you would have write this purpose so you can write that he has been commenced on, okay, or he is commenced on IV morphine, 15 liter of oxygen along with GTN, okay, and furosemide so much and etc, whatever the things are mentioned, not the way you have written. In view of his tachycardia, you don't see, the problem is that you are just overly explaining things. In view of tachycardia, I did this. In view of this, I did this. It doesn't make sense at all. Just write something. You are referring the patient to emergency department, and there is also a doctor. He knows what things are given for what purpose. You don't need to tell that this is the reason for which I am giving this medication. Okay. On this date, he presented with Mr. Alvin presented with mild central chest pain on exertion with mild asthma. His examination was unremarkable with normal ECG and troponin level. Then if everything was normal, then why you are mentioning? He was advised to check serum lipids and review in 1 week with referral to exercise stress test was made. On subsequent visit, he presented with asthma exacerbation. He experienced mild chest pain at high exercise load and slight ischemic changes noted. His cholesterol levels were, or cholesterol was mildly high. She was commenced on Lipitor nitrates, aspirin and anginin as required, with review in 2 weeks. On this date, Mr. Alvin presented again with second asthma attack due to poor compliance to medication. He was encouraged to use as required salbutamol with asthma until asthma settled down, and offered EQS dependence treatment pharmacotherapy. Mr. Alvin smokes 1 pack per day and drinks 10 standard 5 times in a week. He has no family history of cardiac disease. He takes Seretide 2 puffs BD and salbutamol 2 puff PRN with. Again, see, the problem is that over explanation. 2 puffs BD. See, your letter is of 2.5 pages. Just because things were not written wrong, things were overly explained, and that's why you have made this letter very lengthy. okay, and it's not good at all, because you just have, you need to finish your letter within 200 words. Okay, you can't go up. This is not good. You are just looking at the information and copying that information on your paper. It means copy pasting. You're just making few better sentences, that's all, whatever is given in the case notes. It's not the way to write it down. Try to please concise your letter. Try not to put every explanation. You are not sending this letter to someone who is a 5-year-old. You're sending this letter to someone who is a doctor. It can be a consultant, it can be an emergency officer who requires and who is in a better position than you, because you might be a GP. So you have to understand that the other person whom you are referring is a better person. That's why you are sending it. I'm just trying to explain how to think while you're writing it. So you don't need everything to be very explained. Okay, and it's not a medical exam where you do this. So try to cut down your word count. Okay, for this letter I'll give you 300, not because your letter is poor, but because it's not up to the mark.